Hi everyone, this is Nick from Canada Watch, bringing you updates on Canadian politics and current events. On this edition, we will be covering Prime Minister Trudeau's big week overseas, an important announcement regarding interest rates from the Bank of Canada, and comments made by the Canadian Medical Association regarding the state of healthcare. Following the announcement of his new cabinet, Prime Minister Justin Trudeau has left the country for a series of high-profile meetings in the week to come. Last Friday, he accepted an invitation from Netherlands Prime Minister to visit the country, where he addressed their parliament and visited the Canadian War Cemetery. Next few days, he will participate in the annual G20 meeting, which brings together 20 of the most industrialized nations that comprise 80% of the global economy. The G20 meeting is expected to negotiate a number of topics, including economic policy, the future of climate change, and develop a strategy on how to best vaccinate those in lower and middle-income countries. Finally, Trudeau will participate in a summit called COP26, with newly appointed Environment Minister Stephen Guilbeault, in which Canada's actions will be closely monitored on the world stage with regards to the environment. During his first two mandates as Prime Minister, Trudeau has made many prominent commitments regarding addressing climate change. However, recent data suggests that Canada is having difficulty meeting such commitments, and currently has the second worst record in the G7 regarding reducing carbon emissions. The meetings of the G20 and COP26 do not come without controversy. It also remains to be seen what effect these policies and statements agreed upon at these conferences are enacted effectively into Canadian society. Such conferences have faced criticism in the past for their financial cost and have been questioned whether their decisions are actually implemented. Stay tuned on Canada Watch for further developments on what happens at these conferences, and we will bring you updates as they develop. Our second story today involves major news from the Bank of Canada regarding their expected approach to monetary policy going forward. In an announcement made this week, the Bank of Canada kept its benchmark rate, the rate at which many financial products such as mortgages, lines of credit, and personal loans are determined, at a very low 0.25%. However, they indicated this period of low interest would soon be coming to an end. Bank of Canada Governor Tiff Macklem said that supply chain bottlenecks, high energy prices, and a rebounding economy will likely push inflation even higher to around 5% in the near future, before returning to a normal range of 2% sometime in the next year. While Macklem indicated that interest rates would not rise yet, the Bank of Canada made a major step and wrapped up a fiscal tool called quantitative easing, in which the central bank buys billions of dollars in government bonds each week to keep interest rates low. The move is a significant shift in the central bank's monetary policy and is a big indicator that rises in interest rates are coming soon. Leading economists at TD Bank and the Bank of Montreal believe interest rates will rise at least 3 times next year and continue well into late 2023 to return them to levels seen before the pandemic. While in the past it has been determined that rising interest rates normally have a positive impact on inflation, the rise will almost certainly affect individuals who have variable rates on mortgages, lines of credit, and credit cards, as they follow the benchmark rate from the Bank of Canada very closely. Our final story today are statements made by the Canadian Medical Association addressed to new health ministers Jean-Yves Duclos and Carolyn Bennett in Prime Minister Trudeau's new cabinet, calling on them to address the growing crisis in the healthcare workforce. Already being a serious issue prior to the COVID-19 pandemic, the CMA said that high levels of burnout and stress are prevalent throughout the Canadian medical system, and that the issues rise beyond any particular region and should be addressed federally. The CMA is calling on the government to honor its election promises by investing $18 billion in long-term care, access to primary care providers, and a cash infusion to help address backlogs across the system. One of the key Liberal government promises in the last federal election was a $4.5 billion investment over 5 years to the provinces to provide free and accessible mental health services, and it remains to be seen how seriously this will be addressed in the next parliamentary session. With Canadian society going through a crucial period between now and 2035, where a greater share of the population will require access to medical care, the issue remains critical to the proper functioning of the Canadian social safety net, and how it is approached in the coming years could affect the quality of life for many Canadians. That's it for today on Canada Watch, where we bring you updates on Canadian news, politics, and business. Please feel free to like, comment, and subscribe. See you next time.